prevent fractures. And then somebody else was doing cardiovascular health, and they came up with a recommendation that said this level of physical activity will prevent heart disease. And somebody else did cancer. So we all had these different levels of evidence on what amount of exercise would generate the benefit. And we handed this off to the federal government, who actually wrote the guidelines. But they didn't want to give the public 100 different messages. They wanted to distill it down to one message that if you did this level of physical activity, there's likely to be substantial health benefits. Now, this caveat is important for tonight because bone happens to be one of the areas where the physical activity guidelines probably are not sufficient. We probably need somewhere in the neighborhood of 3 to 5 hours a week of physical activity to get significant reductions in risk for osteoporotic fractures. So keep that in mind. I'll show you some of the evidence that led us to that conclusion. If you are so inclined to actually go and look at the evidence report that we generated, you can find it on health.gov website. Our committee report there, it's almost 700 pages. For you students out there, it's an excellent compendium of the evidence of physical activity and health benefits across many systems. I'm going to talk a little bit about Chapter 5 from that report, the musculoskeletal health section. We were asked to address two questions. Is there evidence that physical activity reduces fractures? And is there evidence that it reduces risk for osteoporosis by increasing or slowing the decline in bone mineral density? Because how dense your bones are is the strongest determinant of how likely you are to have a fracture. So for that first question on fractures, these are the conclusions that we came to. Physical activity is inversely associated with fracture risk. So the more active you are, the less likely you are to have a fracture, and that's particularly true for hip fractures. And that's important because it's hip fractures that have the highest levels of morbidity and mortality associated with them. They're the most severe. The second conclusion was that a greater volume of physical activity confers greater risk reduction, but we currently could not make any conclusions regarding whether it's the frequency, the duration, or the intensity of the physical activity that's the key factor. So it's just this much physical activity leads to a reduced risk for hip fracture.
Are you able to tell whether it's more the aerobic component or the weight bearing?
For fractures, no. The question was whether we can tell whether it's aerobic or strengthening types of activities that are most beneficial. From these studies, we could not pick that out, but I will tell you that most of these are large studies when there's fracture as an outcome. It's population-based studies where they ask someone how physically active they are, and then they follow them for a period of time to determine whether those who said they were more active have fewer fractures. And because of the types of questions that get answered, and because walking is the most common form of physical activity, my guess is that this probably reflects weight-bearing endurance exercise as being the primary type of physical activity that's beneficial. But the studies that we reviewed, the evidence, did not separate this into aerobic versus strengthening. One thing we were asked to do was to try to come up with an exposure, a prescription for how much exercise you would have to do or how much physical activity you would have to do. So we looked for studies that evaluated dose response in a quantifiable manner. So some of the studies that we looked at were strictly qualitative. They said this group was very active and this group was not active. Well, that's not quantifiable. So we found 4 studies that had fractures as an outcome where they reported quantifiable units of physical activity, met hours per week, kilocalories of energy expended per week, just hours of walking or hours of physical activity. And surprisingly, the first three on this list are really quite consistent. I won't go into how we equate these different units, but for the average 60-year-old woman, this probably reflects 3 to 5 hours a week of physical activity. This is the level of energy expenditure that they would achieve. And when you do that amount of physical activity, it's associated with about a 40% reduction in your risk for having a hip fracture. Again, with all of these units, we can't discriminate on whether this is related to the volume of exercise that they're performing or the intensity of the exercise that they're performing. When we put this into a different format to make it more graphic, to get the take-home message, these are all of the studies that we found that had at least 3 categories of activity level. And now it could be quantifiable or qualitative. So if it's qualitative, we're comparing now the most active group relative to the least active group. Or if it's quantitative, like I showed you on that previous slide, it would be the group that had the highest caloric expenditure versus the lowest caloric expenditure. And let me orient you to this slide. If the most active and the least active groups had the same fracture rates, then we would expect all of those points to fall right on 1. They would be the same. But since we're comparing the most active to the least active, and all of these points fall to the left side, this is saying that the risk in the most active group for hip fracture is lower than in the least active group. So just looking at the bottom point here, this dot is at about 0.35. That says that their risk of fracture is only 35% of the risk fracture in the least active group, which would be 100%. In other words, there is a 65% relative risk reduction in the most active group. So across all of these studies, at least on average, the risk reduction is about 50%. But the other lines on here, these horizontal lines, are called confidence intervals. That tells us how confident we are that it is truly a difference between the most active and least active groups. And when that line crosses 1, our confidence level goes down. So this is one of the reasons why we took away the evidence away as being moderate rather than strong, because there are some pretty good studies here. These were well conducted, in which there was not a significant benefit of physical activity on reducing hip fracture risk. I wanted to pick out what I thought was probably the best one of the prospective studies that has been carried out. This is the Nurses' Health Study. And this is the one where we see a beautiful dose response between the amount of physical activity that these women reported doing and their relative reduction in hip fractures. So the least active group was set at 1, and then every other group is compared to them. So as women fell into categories by which they reported doing more physical activity, their risk for hip fracture went down. And in the most active group, it was reduced by about 50%. This is one of the few studies where we also get a hint that it is the intensity of exercise that may be important. So because walking was the most commonly reported form of exercise, they also asked these women how fast they walked. Did they walk easy, average, brisk, or very brisk? And there were very few in the very brisk category, so they combined these. But you can see that as the walking speed increases, the risk for hip fracture goes down. And that makes sense because every time you walk, you create impact with the ground, and it's that impact that travels up your skeleton and makes the bones stronger. And the faster you walk, the more impact there is, the more intense the forces are generated. If you don't do vigorous activity, though, it's probably a factor of how long you are in an upright posture, because your hips are aligned, they act like a cantilever to support your torso. The femur has a region where we call the femoral neck. That's what connects your leg bone to your hip bones. And that region of your hip is loaded every time you're in a standing posture. So they also asked the women how many hours a week they were on their feet during their usual activities, whether they're just standing there or walking around. And you can see for those women who were on their feet 40 or more hours a week, they actually had significant reductions in hip fracture risk. So even if you can't do a lot of vigorous activity for a short amount of time, probably just being upright and moving around for many hours is going to be beneficial. Getting to our second question on whether physical activity improves bone density or slows the rate of loss. Our conclusions here are that exercise training can increase or attenuate the decrease in bone density of both the lumbar spine and the hip, or proximal femur. The magnitude of this effect is pretty small. We can increase bone mineral density by about 1 to 3% per year for studies that are carried out up to a year in duration. Now, the bad news about this is that very few studies have gone longer than a year, but those that have don't show that this rate continues. So the 1 to 3% increase seems to be about the maximum that we can generate in humans. And I'll talk a little bit more about that in a few minutes. And here is where we do have evidence that both weight-bearing endurance training and resistance training are effective. And let me show you just a little bit more about that. We actually evaluated for this, our evidence was meta-analyses. So they're conglomerates of many studies that have been considered in a pooled analysis. And there were 15 different meta-analyses that we had to review. Most of them that evaluated weight-bearing endurance exercise training found that there were significant benefits of that type of exercise at both the spine and the hip. But when we looked at meta-analyses, there were only 4 of them that included studies that had used resistance exercise training interventions. Only 3 of 4 of those found significant benefits at the spine, and none of them found significant benefits at the hip. Now let me explain why I think that is. Remember, those are not individual studies, those are groups of studies considered together. So here's one study that was conducted many years ago by a young person at that time. This is when I was in St. Louis, where we tried to use 2 different exercise programs in older women. These were 60 to 75-year-old women who were previously sedentary. This was a 9-month exercise training intervention that involved very vigorous exercise. So these women ended up jogging, going up and down steps up to 1,000 times a day, a lot of very vigorous activities. And we divided them into activities that were weight-bearing endurance, walking, jogging, stair climbing, and descending, and then activities that did not involve impact with the ground. Not just strengthening, but some aerobic activity here, weightlifting and rowing. These are the changes in bone density that occurred over the exercise intervention interval. And you can see at the whole body, at the lumbar spine, and actually at the total hip, there were similar improvements in bone density at some sites. But a site of the hip that's very prone to fracture is that femoral neck region that I was talking about earlier. And there only the impact group, the weight-bearing endurance group, got a benefit. The other group did not get any benefit. So what position do you usually put yourself in when you do resistance training or weightlifting?